Guys, for our most untimely internet connection, folks, but we're back online, hopefully for the duration. This is additional services, compensatory services, extended school year, and monitoring progress of IEP goals webinar. And with us today is Daniel Parker, Assistant Director of Special Ed with the Department of Public Instruction. I'm going to go ahead and start the recording, and then I'll turn it over to you, Daniel. Go ahead.
All right, great. Thank you everyone for being here today. It's a great pleasure to be here for another Wisconsin Facets webinar. I appreciate everything you do. Matthew and staff at Wisconsin Facets, thanks for inviting me today. I'm Daniel Parker. I'm an Assistant Director on the Special Education team at the Wisconsin Department of Public Instruction. Been at DPI about 10 years. I've been an Assistant Director for almost 5 years, and I was a consultant in the area of autism and family engagement for 5 years on the special education team prior to that. And then I was a teacher, principal, general and special education teacher, behavioral consultant, started as a paraprofessional for the previous 15 years. So it's great to be here on this topic. Jump right in. So we're going to talk about district responsibility for providing a free and appropriate public education through the lens of additional services and compensatory, or also known as recovery services. We're going to talk a little bit about monitoring progress of IEP goals and why that's very important in this discussion. And then we're also going to talk about some options and some considerations and thinking when determining whether students need additional compensatory or recovery services, and some ideas around how to provide those, including some discussion of extended school year. There was a lot of resources that I rely on from my colleagues at DPI. And all of these resources are linked in various places. They're listed here. They're not hyperlinked, but they're hyperlinked at the end. And you can see that there's a lot of great information and presentations. We've been doing some great presentations on computer practice meetings that have been recorded. If you want additional information on some of these things, listening to other people talk about it. We have webinars and recorded videos on a variety of topics, as well as written documents that are here. I also want to thank the Wisconsin Statewide Parent Educator Initiative. Some of the content I'm providing today was developed by them as well, and they are a grant that we support through our department. I want to start us making sure that we're thinking about educational equity in terms of ensuring that every student has access to the educational resources and rigor they need at the right moment in their education across race, gender, ethnicity, language, ability, sexual orientation, family background, or income, or family income. And the reason it's important to talk about equity today, when we think about the pandemic and we think about students who might have, it's hard to imagine any family that, things went perfectly great in the last year. But when we think about those that probably were impacted the most, we need to be thinking about our most marginalized students and families. Traditionally, when resources are scarce or when there are national health emergencies, we know that some of the groups that I mentioned in this slide are the ones who may be most marginalized. Our students of color, our students with significant developmental needs, our students with significant social emotional needs, etc. It's important that we're thinking about maintaining and deepening relationships as a key to helping everyone's mental health and that connection between schools, families, and educators and our community members supporting us. We really want to focus on collaborative decision making that are really focused on the individual and student family needs and circumstances. We want to increase capacity of families and general education teachers as special educators to maximize least restrictive environment. So we don't want situations like this past year to end up in students being further marginalized or further secluded from education. So we got to keep that least restrictive environment in mind. And we want to practice self-care. It's really hard to help others when you're struggling yourself. So we have to take that time and practice that self-care. The learning environment has changed in this last year, and schools are still continuing to adapt to changes caused by COVID-19. Everyone just take 15 seconds silently and think about a student or a family or your child, and think about how this year has affected their learning changes and your personal experience in this last year. I don't work in schools right now. I work at the Department of Public Instruction and support people working in schools and families whose children go to schools. And I think often about the students that I used to support, whether it was when I was a principal or a special or general education teacher, and I think about what would we be doing right now? I think about that all the time, and I can't possibly imagine being in your direct shoes right now, and just want to shout out the appreciation I have for families and students and educators and community members working through this. One of the things that has not changed with all the changes is special education requirements. Those have not changed. This is a quote from the US Department of Education, and I'm just going to read it. It says, "To be clear," and this came early on in the pandemic, March 21, 2020, so over a year ago. "To be clear, ensuring compliance with the Individuals with Disability Education Act, or IDA, Section 504 of the Rehabilitation Act, and Title II of the Americans with Disability Act should not prevent any school from offering educational programs through distance instruction." We also at the Department of Public Instruction came out with guidance around providing free and appropriate public instruction, or sorry, free and appropriate public education during the pandemic. And this is just a quote from our guidance, that schools must have in place for this school year, 2020-2021, an IEP, or Individualized Education Program, for each student with a disability that is reasonably calculated to enable the student to make progress both in general education curriculum and toward their IEP goals that is appropriate in light of the student's circumstances. Now, a lot of people ask, what does FAPE, or free and appropriate public education, mean during a pandemic? Like what? Because FAPE means a lot of things. There's procedural requirements in special education, and there's also substantive requirements on outcomes and what we want. And I'm just highlighting a few of the important things that we've put into our guidance during this time. You know, first of all, that IEPs must still be reasonably calculated to enable students to make progress and appropriate in light of their circumstances in both age or grade level general education curriculum and towards their IEP goals. So that's important. Are students making progress in general education curriculum and towards IEP goal based on that student's unique circumstances? Because every student with an IEP has different needs and abilities. IEPs also must be implemented as written. So that's an important concept here, that the IEPs throughout the school year have to be implemented as written. A couple other things, we want to make sure that we still have ambitious and achievable IEP goals. You know, we shouldn't have lower expectations for learning. We might have different expectations, but we don't want to reduce our expectations in comparison to students without IEPs, et cetera, just because we're going through a pandemic. We still need to be as rigorous as is appropriate for each individual student. And we also know that typical methods and procedures for collecting data related to progress monitoring should continue to be utilized. So we still need to be, we'll talk about that later, we always need to be collecting data and information to show growth, and that should be continuing even during this pandemic. If you want more information on what FAPE, or free and appropriate public education, means, there was a bulletin written prior to this pandemic that really outlines responsibilities of FAPE, and that applies, those all apply as well. And that bulletin is linked there. We also know that there's been flexibility in light of COVID-19. Just like one of the things I love about special education is, you know, we're problem solvers. An IEP team, the parent, special education staff, related services, principals, LEA reps, those people at the table, school psychs, occupational therapists, physical therapists, all the important people that must be an IEP team sit down and they say, what is the student so good at, and how do we best help the student with their individual specific needs? Because every student has their own disability related needs. And what the day looks like, what the programming looks like, what the services look like, what the accommodations and general education supports look like, all of those things are completely flexible based on that student's needs. My background in working with students with autism, we had to be extremely creative on how to navigate students where a traditional learning environment isn't the best fit for them. And we have to make sure that learning environment is best suited for that student to support them in the least restrictive environment as much as possible. And so IEP teams, including the parent, have been working creatively to figure out how to do this during the pandemic, and we know it's been very difficult. And free and appropriate public education, it really needs to be provided and can be provided consistent with the need to protect health and safety of students, with those individuals providing special education and related services. So, you know, this information is just something to keep in mind, that there are maybe not, we'll get into how difficult this is and when it doesn't work, but I just want to also acknowledge that last year more than ever, educators were using practices such as distance instruction, teletherapy, virtual instruction, low-tech strategies to provide curriculum-based resources, instructional packets, projects, written assignments, blended learning environment options. You know, just because a school may not have had access to in-person learning for all students, there was only one instance in the state that I know of during this school year where in-person instruction for all students was prohibited. It may be for the general education, including students with IEPs, there was no in-person instruction, but special education IEP teams have always had that option to say, is there a possibility for some in-person instruction if it can be done safely, so that we can support students during this pandemic? Unless there was a public health order this year prohibiting any in-person instruction, even though some schools were closed for general education supports, IEP teams could make that decision to provide some in-person instruction and blend that with some virtual instruction to make things work. And I think we just want to applaud those that figured that out. There's also been a ton of resources. I'm just going to open this link really quick. This is a supplementary resource page, and I haven't updated it in a while, but there have been so many national organizations that talk about all of these ways to support students during the pandemic. Lots of curating of how to do this. And we've also broken this out for young learners, transition age youth, participating alternate standards, students with neurodiverse needs, et cetera. So I just want to acknowledge, you know, kind of the strong innovation that has happened during COVID-19. Now, with that said, well, let's rewind also that a lot of this was done through contingency plans. I just want to make sure we're on the same page with language. At the beginning of the pandemic, we kind of had this graphic, you know, can we implement this IEP as written? So if it says the student can go to in-person instruction, the district was doing in-person instruction, everything was the same, that's a yes. But if not, then we need to have an IEP team meeting and revise the IEP through an IEP team meeting. And if the opening plan changes, we need to consider contingency plans here. So many of you are probably familiar with contingency plans that were written into IEPs, and you were a part of that decision making. To say if in-person instruction closes, what are we going to do? Are we just going to do virtual learning? What are the services in the IEP going to look like in a virtual learning environment? Is there an opportunity to do some in-person learning, as I discussed? You know, how is that going to work? And each IEP team determined that based on each student's need. Just some examples, you know, some students, the contingency plan went all virtual. So this is an example out of our guidance. So what it would say is for self-advocacy instruction, here's what it looks like in person, but then for instruction, if the school was closed, here's what it's going to look like in virtual. And it's just going to continue, but in a virtual format. Other examples, sometimes you would have some in person. So on days student attends in person, this is what they're able to get if the student was able to attend. And here's how they're going to get speech language therapy on days student attends virtually. Again, this kind of just comes from one of our guidance documents on creating contingency plans. Now, let's get into when the contingency plans maybe did not work, or maybe were not implemented or developed, and students did not get the services that they needed. And we want to recognize that COVID-19 pandemic created barriers for some students with IEPs to accessing services or making progress on their IEP goals. IEP teams on a case-by-case basis need to determine whether additional services, compensatory or recovery services are required. And I'm going to get into the differences of those three things. They also need to consider whether progress towards IEP goals, the annual IEP goals, including post-secondary transition plan goals for students aged 14 through 21, if students are making progress on their IEP goals, and if they're making progress in age or grade level curriculum. So these were kind of the questions that you're going to be asking when you're thinking about compensatory, recovering, and additional services. So let's break out the difference between additional services and compensatory services. And I have extended school year here in the middle too, because we're going to be talking about that later. So additional services were provided as a result of the school closure last school year. So when schools closed in March through June, there was a state order that there could be no in-person instruction, including for students with IEPs. And that meant that districts within the first 6 months of the school year had to have a meeting and discuss with the parent, or have a conversation with the parent and do it through an I-10 form, which is a form you can use in lieu of an IEP meeting, whether or not, because of that interruption between March and June of last school year, does the student need any additional services? And we're going to talk a little more about that. And so that decision, again, is based on the impact of the school buildings being closed due to a statewide public health order from March 18th through June 30th. Compensatory services, the way we discuss it in Wisconsin at the Department of Public Instruction, that is a term that has been around prior to the pandemic. And that occurs when services designed to address any lack of expected progress due to the effects of the pandemic. So in light of the pandemic, these are services designed to address any lack of expected progress. These decisions can be made at any time. So it depends on, when the school was closed or at what point you're making this decision. But this is based on the failure to provide a free and appropriate public education during the 2020-21 school year due to the effects of the pandemic. So kind of a difference of additional services and compensatory again. Additional is more about the school closure due to the public health order statewide last year, where schools could not get any supports in person. And some schools were closed during that entire time. Whereas compensatory services are a term we use for this school year because schools could provide some services. They should have had contingency plans in place. Even if students were getting virtual instruction and in-person wasn't possible for whatever reason, we did expect a free and appropriate public education to be provided, meaning that students were still progressing on their IEP goals and were still advancing in their age or grade level curriculum. Now, extended school year, and we'll talk about this later, those are special education and related services provided pursuant to an IEP beyond the limits of the school term. And these decisions can be made at any time, and they're based on the need for services outside of regular scheduled. So this is more of a decision of when you will get these services. So whether there were additional services discussions that already occurred, or compensatory services discussions that are occurring now or may have occurred recently, extended school year may be a time when IEP teams want to provide those services. I'm going to go into each of these a little more detail, and I'm going to stop for a minute for any questions. So again, summary again, because I know this gets confusing. Additional services, spring 2020, we were under a statewide order to close school buildings. Some special education services could not be provided, or maybe they just weren't effective if they were provided to some students, those districts that did go virtual. Maybe that instruction wasn't as good as it could have been at that time, or was not effective based on that individual student's needs. And decisions about additional services should have already been made on an individual basis in a collaborative manner. Again, those services had to be made within 6 months of this school year. So that, for me, tracks to around February, March. Additional services address regression of skills and are needed to accelerate progress. They must supplement and not supplant the special education services a student normally receives. That's a term we use a lot in special education. They must supplement, not supplant. That basically means you can't just do what you're already going to do and call that additional services. You know, they can't just be, if your student was getting twice a week the same amount of service and the exact same service. So it could be a change to the service. So it's not a minute-to-minute comparison, but something has to be in addition or different about that service. It can't just be the same thing they would be getting anyway to be able to call it additional services. And IEP teams may also have considered whether the student required new services. One of the things we talked about when we were talking about decision-making around additional services, and this is true for compensatory services, is a pandemic, disability-related needs and learning is based on context of education and where the student is at. And this pandemic may have triggered needs in students because of their disability that need additional support. And mental health has come up a lot, social emotional learning, et cetera. So we really need to be thinking about that student's present levels of academic and functional performance. Functional are those areas like social emotional learning, adaptive skills, et cetera. And we need to say, are there things we need to support? Another thing that's come up, if a lot of students have been learning virtually, how independent are they able to access that virtual instruction? And do they need some discrete special education, specially designed instruction support? Or maybe they just need some accommodations so they can better access that virtual instruction because it's a different learning environment. So that's what we mean by looking at new or different. So to summarize additional services, those discussions occurred, but the services that students might be receiving may be happening now or may be happening this summer, and we're going to talk about that through extended school year. And they address the significant regression of academic or functional skills due to the emergency school closure. Documentation of additional services should be in the IEP. So if you're unsure if the additional services were discussed, you can look in the program summary of the IEP, and they should occur by August 2021. So we would expect that those services be provided by August of this year. So let's talk about compensatory services, and I am going to stop to see kind of where we're at with our definitions before we talk about the how of some of this. These are also referred to as recovery services. Nationally, they use that term sometimes. These are required as a result to provide FAPE, or free and appropriate public education. So that again means one way to think about failure to provide FAPE. There could be different ways, but one of the main ways failure to provide FAPE is lack of progress on IEP goals and lack of progress in general education. We'll talk a little bit more about what that means too and how to make that decision. IEP teams should consider IEP implementation during the school year when they're thinking about compensatory education. Some factors of why a student might need compensatory education in light of COVID-19. There's kind of three big buckets that I think of when I think of why might a student need compensatory education. One is they just didn't get the services during the school year. No services were provided. Wow. For some students, that doesn't mean they necessarily have to have compensatory education, because not getting those services, maybe the student is still on track for meeting IEP goals and on track for making progress in general education. That is a possibility. It's a case-by-case situation. But not receiving services certainly could be a reason for a lack of providing FAPE. Students may have been provided virtual services or even a blended, some virtual, some in person, but those services were not effective in allowing the student to make sufficient progress toward their IEP goals and in the general education curriculum. So maybe the services were provided, they just weren't effective. Another bucket that sometimes comes up is eligibility for special education was delayed. So if there was an evaluation or a referral for a special education evaluation, the student did not have special education services, but then they were, a referral was made, but the evaluation could not be completed and was delayed due to COVID-19, it's possible that the IEP team might say, you know what, we need to really look to see if any compensatory services are needed to kind of accelerate that progress, support that student, to give them what they need, because they did not receive the services probably when they would have if COVID-19 and school closure had not happened. In all cases, school districts, and I apologize for not spelling this, LEAs is local education agency, which is basically a school district. It also includes 2R and 2X public charter schools. Charter schools are public schools, and they have the same requirements to provide free and appropriate public education as traditional school districts. But in all cases, the school district must determine on an individual basis if compensatory or recovery services are required because the student did not receive a free and appropriate public education, or FAPE, for all, or a portion of the 2021 school year. You'll see this link in a lot. We have a COVID-19 special education question and answer document that answers lots of questions about this as well. So,
Daniel,
yes,
can you hear me? We had a question pop in. Do you want me
sure.
to hold it another couple slides, or is now okay?
Yeah, I have a slide for questions that'll be popping up soon. So let me get through this piece because I
Okay,
might answer
okay.
it. Yeah. So making compensatory recovery or additional services decisions. So some shoulds and some should nots. They should gather student and family input. I mean, the families, especially if they were supporting learning at home through virtual instruction, they know a lot about their children's learning and ability to access and make progress in that learning. So we should definitely be gathering that. Consider how and when services will be provided with the family's input. Consider student progress. Collaborate on an individualized plan for services to supplement the student's disability-related needs and goals, and document the services. Do not make predeterminations based on a primary disability. You cannot say that all students with autism are going to get compensatory services and all students with learning disabilities are not. You cannot do that. They're individualized decisions. You cannot preclude a student from services based on availability. So you can't just say you can't have services because we don't have the resources to provide that. That's not an excuse. You have to have that conversation whether student needs it and figure out what it looks like and how you're going to provide it. You cannot offer a preset amount of services that are not based on an individualized determination. So you can't say, here's what all students with IEPs are going to get for all the students that need compensatory services, and it's going to be the same thing. You can't do that based on a disability category either. It has to be individualized decisions. You cannot replicate all the services and supports to supplant the current IEP. I talked about that earlier. It needs to supplement and not supplant. So you cannot just say, you know what, we're just going to cover that by doing the same thing we would have done anyway if we were not providing compensatory education. So you can't do it through, those services have to look different in either what they are or the location, duration, frequency, or amount of them. And you cannot deny services due to earning a regular high school diploma or reaching maximum age. I'm going to talk about graduation later. So for both additional compensatory or recovery, whatever you're going to call it, any of these decisions, you want to look at parent and family input. You want to look at, and here's a great document from the Wisconsin Statewide Parent Educator Initiative. This was created for additional services, but I think it really fits well for compensatory education as well. There's a few questions you might not have to answer, but it asks parents to say, what are important questions that you have about your child's learning? It tells you to organize your child's records. Like, you should understand your child's report cards prior to the pandemic, during, etc. Collect reports from people, collect samples. It tells you to write down your observations of your child. And even if you haven't done that, what are you thinking? What do you remember during loss of learning, if that occurred, that you want to write down? It has some nice questions there. Prepare to talk about concerns you have with the IEP team meeting. Focus on child's needs and some ideas for communicating with school. So I just wanted to share that. Another part of this decision You're going to look at your students' present levels, where they're at in age and grade level academic and also functional, like social and emotional areas, daily living skills, organization, etc. How are they doing now academically and functionally compared to before there was interruption or changes to services? And compare the data to the student's current progress. You want to consider progress compared to all students. That is something you want to look at. It is very individualized, but it is important also to be thinking about what was the progress all students made, because lots of students did not make the progress potentially with and without IEPs due to the public health emergency. That just because all students didn't make progress doesn't mean that a student still might not be eligible for compensatory recovery or additional services. But it is one of the factors in the equation you want to look at. Again, it's an individualized decision. You're going to look at the students' present levels and progress compared to grade level expectations, and then you're going to see how much regression or failure was made to make progress on IEP goals. All right, I think this is a good time to stop for that question now, Matthew.
All right, so first, just so this person knows that I didn't miss them, we have a general comment with which I am confident we all agree that it is sad that it took a pandemic to reveal problems and barriers to learning inherent in a system still operating on what this person calls a factory model and an agrarian calendar. So you can respond to that if you choose, or we can kind of ponder that a little bit.
That is one to ponder. I think we all recognize what I think we all recognize that there are a lot of new ways to support students and what is really important in supporting students. I'll just say that. And that there needs to be new ways to support students. I think a lot of us always felt that way, but I appreciate that comment.
And so the question that popped up then is, if parents refused to have students attend virtual or face-to-face options that were listed in the child's IEP, are compensatory services required?
So compensatory services, again, is a case-by-case situation. So there's not like an all yes or all no answer. But what I will say is there could be very good reasons why a parent, and I'm going to just kind of throw out, we heard this often, students with medical fragility, of why a parent would not want their child to participate in the services that may have been offered. And I would like to say, ideally, the parent was, well, not ideally, the parent would have and should have been involved in making that decision. I understand that with parent input, sometimes the decisions made are not the ones that the parent would prefer. So I want to acknowledge that, but the parent ideally should have been involved in that. So the term offer is something, hopefully I would say agreed upon, but at least let's say the services that the parent had an opportunity to provide input on. If they decline those services, we can think of many reasons why that may have occurred. And there is in the FAQ, and I want to pull it out to be specific, but parents not making their student available because of concerns, for example, about their child contracting COVID-19, or perhaps the virtual learning schedule that was provided did not work because they did not have the technology. I mean, we could come up with examples, but that does not mean that a student is not entitled to compensatory services. Not at all. And it's more complex than that, but I will say that it doesn't mean they will, and it doesn't mean they won't, but just because certain services were documented in the student's IEP and the parent did not make them available for that does not automatically mean they're not eligible for compensatory services. And I could probably speak more to that offline, or if that parent wants to know more about that, contact the Department of Public Instruction on our website. I'll show you at the end where you can quickly click on a box and ask a question, and one of our consultants will get back to you and kind of outline what options you have. I'm going to stop again for some questions, but I want to get into a few more things, if that's okay, Matthew.
Sure.
So let's talk a little bit about progress monitoring, because a lot of this comparing progress of where a student is prior to the pandemic and where the student is now, whether you were doing that for additional services or whether you're doing that now or recently for compensatory services, the analysis is very much the same. You know, what was the student's growth and what were their present levels prior to a lack of services or inefficient services, et cetera? And what does it look like now? And we call that regression, kind of comparing, you know, regression means that that the progress that a student is making is, you know, not at what we would have expected. And so for students with IEPs, we're comparing that student to their progress before and after this interruption in learning. And so to do that, you have to have progress monitoring data. And this is just an opportunity and plug for me. One of the things that I think all schools need to look at and do better, and that includes when I was in a school collecting data. This was the hardest part as a special education teacher, as a general education teacher supporting students with IEPs, as a principal setting up systems of support for my educators. This can be one of, it's not a complex concept, but for whatever reason, having a system to do this well, we can do better. But we really need to know when we're monitoring progress of students' IEP goals and in their programs, you know, are we able to really address how are they progressing and supporting the students' disability-related needs? Is there any lack of progress toward the IEP goals? Is there any lack of progress in general education curriculum? And you know, how are those services and student progressing? There's lots of methods for progress monitoring, and I just included these slides so people knew about them. I'm not going to get into them. That's it. We do have another webinar, and it's in the resources on our step 5 analyzing progress of IEP goals and our CCR IEP 5-step process. There's a webinar, there's resources, there's charts, there's modules on this, but there's lots of ways people collect data and information, and many of these can be done virtually. We have a whole webinar that talked about how you can collect these through a virtual learning environment. That progress is so important to collect. So I just want to use this as an opportunity and a stage to say, you know, we should be really making sure that we're measuring progress in relation to those goals, into relation to how that student's progressing in the curriculum, and making sure that we have that data so that we can make these decisions and make them very specific to each individual student. I'm going to switch off and talk a little bit now about compensatory services for students graduating or turning 21, and then I'm going to talk about kind of how we can provide these services. One of the things that's really important, and our Council on Special Education at the Department of Public Instruction really wanted to look into, is there were students who might have been 20 years old and would be exiting special education at 21 who had job-related or community-related IEP supports that could not occur because of the public health emergency. Businesses were closed, et cetera. It just wasn't safe. And so what happens to those students? They missed a whole year of services, and by the nature of their services, they might have been job or community related, and they may need additional services or compensatory services. So we issued a joint memo last couple months. You can link to it there, that talks about the importance and ability for compensatory services to be determined for those students who might have turned 21 and exited special education services. The student may not have made progress. They may not have gotten their planned transition services. And they may need connection to supports and services that will facilitate a smooth transition to post-secondary environments. So, you know, they may just need a little bit extra, not a repeat of all the services that they would have gotten, because it's not a one-to-one correspondence, but there may need to be a meeting and a discussion to say, for those students, should they receive compensatory services so that they can get some transition planning that they need to support them that they missed out on because of the pandemic. So some questions for those types of students turning 21: what services and supports would help the student make progress? To what extent is the student and family willing to participate in those services? Some students may be like, see you later, I'm ready. Some other students, it may be that DVR, DWD, DHS, these other organizations, Division of Vocational Rehabilitation, all of these other state agencies that kind of take over supports for our students with most significant disabilities after they leave education, those agencies are likely already involved and may be able to cover what that student needs, and maybe the school doesn't need to continue and education doesn't need that support. So it really just depends on each individual student. For compensatory recovery or additional services, whatever we're talking about here, they must be clearly labeled in the student's IEP, such as the program summary section of the IEP. They must include the frequency, duration, amount, or location of those services. I threw in this, they could include a contingency plan. So we don't know. I mean, I'm hoping we're mostly out of this pandemic, but you never know. Learn not to guess on things. That's for sure. Learn not to guess or predict the future when it comes to the pandemic. And maybe if there are additional or compensatory services, it might be good if you're having those discussions, or maybe if you already have, or maybe even just checking in with your IEPs. What are we going to do if there does have to be a school closure? It's a strong possibility that contingency planning might be a kind of component to IEPs moving forward for any natural disaster or emergency. Especially for students where virtual options works pretty well in lieu of not having in person. Contingency plans might be a good idea in certain situations to include in IEPs. Services must supplement and not supplant the student's existing educational program. So again, you have to have something be different about these services, either in their nature or their frequency, duration, amount, or location of them. And then funding for all of these services, just so everyone knows, every state received a considerable amount of money through what was called the CARES Act, federal stimulus funds. And districts can use that money that was provided to them because of the pandemic to support students with IEPs. We have really emphasized districts in thinking about the students who had the most interruption to their services, whatever student groups those were. And I'm going to guess that students with different abilities, students with individualized education programs, are likely ones where it was more difficult to provide them with the services they needed during the pandemic. And we're hoping that districts really take a look at that and utilize those funds accordingly to support them and they need additional services, compensatory services, or recovery services. And there's additional information about funding there. I can stop again if you have a quick one or two questions before I get into some of the hows of and the ESY.
We've got several. And one of them you may have covered what this person is wanting to know, but otherwise I will try to answer them in the order received. The first one boils down to the parents received a contingency plan during the pandemic, which included additional services being offered, and I won't share the details of what those services were that the person shared in here. But the parents were uncomfortable with the fact that the services were only offered in person for health reasons related to their child. And they got something back that said parent declined services. And the question comes down to, is it okay for the district to write the contingency plan? I'm having to scroll down and mouse slipped on me here. is it okay for the district to write this contingency plan, including additional services, and then not provide them because the parents did not agree with the location of where the services would be provided?
Yeah. And again, I can't say a yes, no for any individual case, but what I can say, and I can't assume that the information you provided me is all the information we would need to know to make that decision. So I again would encourage you to just contact the Department of Public Instruction and provide your specific situation. And if you feel that the district did not provide you with a free and appropriate public education and did not provide you with the services for your child based in this situation, you will have those dispute resolution options, and I'll cover those at the end around requesting a mediation or filing a state complaint, where we would actually do an investigation to give you your answer. But we do require to be able to go that into the fact finding of the specific situation. For us to make a determination, we are required to use our state complaint process to do that, or a due process hearing process. So it's hard to say, but again, I just want to reiterate that our hope at the department was that schools and families work together to get what students needed, and recognize that they're still figuring that out, and that we would encourage schools and families to continue to come back. And especially if a student cannot be available because of a concern about the services being in person and the student is at high risk to getting the infection, and we are in a pandemic, those are valid reasons for why a family and a student would not be able to receive those services. I'm not going to say that does mean that there still has to be compensatory services, but it doesn't mean there does not. It doesn't mean, I don't want to go double negatives, I'm trying to figure out how to say this. It doesn't mean the student still can't have compensatory services in a way that that student needs it. But we need to really have that discussion on an individual basis, and it's too hard to do that in an audience at a webinar platform like this. So I would encourage you to contact the department.
Okay, thank you. Just to give you an idea of where we are as points in time, it is now 12:56. Most of the audience has hung with us, and thank you all for that. We want to be fairly respectful of people's time while getting to as many questions as we can. There are several more. They started flowing in at 12:41 about the last break for questions. So that's where we are. Is the next question in order comes from 12:41. So Daniel, if you want to do your section on dispute resolution, and then we'll circle back, we can.
Well, there is more, and I know I ended up starting about 8 or 9 minutes late. There was technical difficulties,
Yep.
so I was hoping to have the full hour.
Yep.
Will we be able to go
You
to
certainly may.
110? Great. So let me go into a few more pieces here. I want to talk about extended school year, because this is a potential discussion that goes with compensatory and additional services discussion. So you've already had additional services discussions that they were required to happen in the first 6 months of the school year. Compensatory services discussions may have occurred at any time. They're very similar discussions, basically because of COVID-19, does the student need some additional supports? And one of the times when that might occur is through extended school year. In my head, I always think of extended school year as summer school, but technically extended school year, it can be any time outside of the typical school day. So it could be during breaks, it could be after school, technically, I believe, and it could be, but it's often extended school year over the summer. Extended school year are special education services provided outside the school term. So I want to backtrack on that after school. But outside of the normal school term, IEP teams determine services are necessary for the provision of a free and appropriate public education. So extended school year services may be provided during the normal school year, during school breaks, vacations, appropriate, not after school. You could still do compensatory services after school if you wanted to, though, but extended school year is during these times. If there is a public health order that does not allow the school district, LEA, local education agency or school district to conduct in-person learning, ESY services must be provided through virtual learning. So ESY services can also be provided through virtual learning. The purpose of ESY services is to address significant regression during an interruption in services and slow recruitment of skills after services resume. So you can see why when additional services discussions were being held, some IEP teams might have said, let's have these services be provided during extended school year, you know, like over the summer or during a break. Or they might have during compensatory services discussion said, you know what, here's what we're gonna do over the summer term to provide extended school year services for those compensatory services. So the ESY analysis has not changed due to COVID-19. So you should continue to use their professional judgment and the data to determine this. So some of the things that I talked about before around regression of skills, looking at where the student was prior to the pandemic, et cetera, growth, all of those things are important in that. Getting parent family input, all still very important. Extended school year services are a multi-factor determination, including the likelihood of whether the student is going to fall back or slow or not be able to learn quickly enough to get back to where they were. Consider all the appropriate factors in determining whether the student benefits accrued to a student during their regular school year and whether it will be significantly jeopardized if the student is not provided extended school year services. A good question is like, how much farther behind are we going to be if we don't have these services? You know, that's kind of getting at that. And you can see there's a form for extended school year that outlines the frequency, amount, location, duration, and it has the goals. And so it's for supplementary aids and services, specially designed instruction, related services, or program modifications or supports for school staff. So the same things you would provide in an IEP, they can provide it around extended school year. It is different than summer school. People get confused by that. ESY is not limited to summer school schedule. So again, it can be during school breaks, et cetera. And it's not limited to disability categories. So school district can't say, oh, you know, we don't provide extended school years to students with other health impairments. You know, it's not limited to disability categories. It's an individualized decision. It can include related services, and it may differ than the services during this regular school year. There is a whole bulletin of guidance around extended school year you can look at. Some considerations, and this is kind of where I'll kind of wrap up because the rest of the slides are just resource slides. You know, I would really make sure people are thinking both academically and functionally about the students' disability-related needs, goals, and services. We don't want to underestimate the social and emotional learning, adaptive, independence, all of those skills that make academic learning possible, you know. We need to be looking at those and look at how typical, you know, students without IEPs, you know, what is the expectation for a student in 5th grade around social emotional competencies, and where is my student with an IEP? And, you know, because of the pandemic, are they even further behind, and might we need to get some additional supports or resources so that they have those functional skills so that they can be successful and access their education and make progress. So those academic and functional intertwined. We want to think about students with medical fragility. I've already gotten calls, and I know we've gotten calls, and I will tell you, I wish I had answers. We have a document on some ideas to address facial coverings, including students with sensory needs. I think back in my days working with students with autism, and I think about the students who could barely tolerate a shirt with a tag on it. And I can't imagine some of those students, how they would react to being required to wear a facial covering for a majority of their school day. And so I know there's creative solutions out there. There are some resources in the slide deck that might give you some ideas. And there is the hope that we will return to some normalcy and that we might need compensatory services or recoupment and do some additional things to catch students up because of this pandemic and this situation. But we want to keep going back to the drawing board and trying to figure out what's going to work for students. And we have some webinars on this topic that go deeper into this that are listed in the resources that you can access. They're through YouTube videos, so they may give you some additional ideas. Thinking about teleservice, I bet teleservice just exploded. We have a whole web page now on teleservice with resources, and we actually fund a grant that is doing teleservice through the COVID-19 project and through CISA 1 that is doing teleservice related professional development for speech language pathologists, occupational therapists, physical therapists, school psychologists, social workers, all of those related services that can be provided through teleservice. So there's a wealth of information about that, and that might be an option to be thinking about. Consider if in-person, virtual, or combination works best. You know, I also don't want to make the assumption that virtual learning was horrible for everyone. There are stories out there that some students thrived under that. I think there are more stories of families where they did not, and partially that might have been because we're not good at it yet as a pedagogy, in our educational framework, we're not that good at it. But I will say that that for some students, some of this virtual learning, teleservice, et cetera, has worked well. And maybe if that was true for your child, maybe it works better to try to figure out how that might look for extended school year if those additional services were needed. So just a thought there. And then thinking about transition and supporting anxiety, mental health, sense of belonging, relationships. I want to bring that back, the importance of that. You know, I often heard early on in the pandemic, one of the most important things for families was the teachers just talking to their students and having some one-on-one time, even if it was virtual, or driving by their house and waving out the window. And finding those ways of maintaining that personal relationship. And after a year, you know, we need to think about that transition and how students are coming back and really be thinking about how are we going to make this work well for students. Be prepared to provide positive behavior intervention supports matched to the student's needs. Students may be coming in with more trauma or mental health needs, and we need to not be disciplinary responsive to that in a traditional kind of, you know, you act this way, so I have to do this. We need to be anticipating what behaviors may be coming in, thinking about why those behaviors are occurring, and supporting those students' needs. That could be more breaks, that could be more choice, that could be better relationships with students and more emphasis on relationship building instead of getting through, you know, a specific academic task, and trying to think about how the academic tasks and the relationship building are intertwined, so you're doing both at the same time, those types of things. Pay attention and respond immediately to disciplinary removals or reduced access to services. You know, I'm really fearful that for our students with significant behavior needs that they'll have, you know, if they're coming back and the pandemic have affected them in such a way they're going to have more behavior that is unexpected and may get in the way of their learning and the learning of others. I'm worried about disciplinary removals. I'm worried about shortened school day as a response to that instead of proactive strategies. And so I really think we need to pay attention as educators and families, community members, and making sure that we are prepared for the students coming in and supporting them so that they are in school and getting the best that they can get coming back in. And remember that the goal is to recoup, rebuild, and accelerate students' academic and functional skills so the student is meeting IEP goals and making progress in age or grade level. That is what our goal is. Keep our eye on the prize. You know, that is what we need to come back to, is making sure that our students have those academic and functional skills so they can meet their goals and make progress in age or grade level curriculum, because that's a big part of free and appropriate public education. Lots of information for families. I'm not going to get into it so we can answer some questions. There's lots of steps families can make to support them in this discussion. So you have this slide so you can go back to it. I went through that WISPE document as well. Thank you, WISPE, for helping develop this, the Wisconsin Statewide Parent Educator Initiative. Some considerations for schools and thinking about how to engage families. If you're an educator in here, please take a look at this slide when you come back. Listening to understand is so important, just stopping and listening. Here's those communication options around IEP facilitation, mediation, state complaints, and due process hearings. I know Wisconsin Facets does a lot of work with IEP facilitation and mediation. They're a partner in the Wisconsin Special Education Mediation System that does this and do webinars on this. So they're a great resource if you want to know more as well as the mediation system. But these are your options. I would recommend contacting the Department of Public Instruction. Again, the rest of these are just resources. I want to throw out that we have a great Assistive Technology Forward project that has a web page at DPI. UDL Forward has its own website. All of these supports have recorded webinars and content. We have so much content and ideas from the pandemic, and we've broken in most of those that we have videos for. We've broken it up so you can find kind of what you're looking for as well on our webpage through different modules, so you don't have to watch something for a whole hour. And then lots of resources. So let's hear some questions.
Okay, so the vast majority of folks are still hanging with us. So again, thank you for your patience, and thank you, Daniel, for your extra time and your poise throughout the mother of all internet outages here at the Facets home base. So the first one in order, as sent, says, what would you suggest, or what should you do if you requested additional services to address regression after school closure for your student with an IEP, and now the school is saying that they will do ESY instead?
So the question is, you wanted it to be after the parent wanted the additional services, or we could say, or compensatory services, depending on the situation of anyway. They wanted it after school, and the district said we're going to provide it during the summer school, or during extended school year. Sorry, I'm not very eloquent today. Yes, so the department encourages families and educators to make that decision together. Again, you certainly can contact the department, because there's probably more details to that discussion that we would need to know to provide a specific answer. And what I'm hearing as a theme is there was a discussion, the parent wanted a certain way or waiting until the student was ready to get in person, or at a certain time they wanted the services, and the school said, no, here's what we're going to do. And the parent, that was not the parent what worked best for the family. And I'm not going to say that, and so it is an individualized decision, and we'd have to look at the specifics to know whether or not the district was able to make that decision and carry it out in a way that met the procedural and substantive requirements. So I think, yeah. So it's hard to know.
This
I would,
parent,
yeah.
this
My hope
parent
is,
has.
go ahead.
I was just going to say, this parent has now chimed in with, the school never met to discuss additional services. They are saying they can only do ESY.
Yeah, that raises red flags for me. The word only without a discussion usually doesn't, if that is the process used, that often does not bode well for making an individualized decision with the parent through an IEP meeting or a conversation, and then documented on an I-10 form. So I would, if I was that parent, I would say I want to have an IEP meeting and have this discussion. I would contact the special ed director so that they were aware of that concern directly. And I would contact the Department of Public Instruction to discuss the concern and go through your options and consider, if you wanted us to do an investigation or not, where we would make the decision of whether or not that was allowed. I'm just going to type special education into the DPI webpage to show you how to do that question. So if you go to the special education team webpage, at the bottom of the webpage, there's a contact special education button, and that's one way to contact. Another is you can just call this phone number, 608-266-1781, and we have people that answer the phone, and they will get you in contact with a consultant at the DPI, and we are all, pretty well versed on our information related to this, and we have procedural compliance consultants that can also assist if a consultant that you're speaking to needs additional support or more specific information about legal requirements.
So thank you for that. That's helpful. I will add that I'm not going to go into details, but this same parent has other concerns that in the interest of time, I won't share in a public forum. So I think the sharing you just did will be timely for this individual.
Yeah.
And we did have one person who now has left, the next person up. I'm still going to ask this because I think it'll be valuable for the recording. Um, it said, what would you suggest for comparison levels for students who are in a transition program?
So does transition program mean 18 to 21-year-old services?
The person has left, but that was my interpretation as well.
Yeah, that's a great question. You know what I would go to is the slide that we have, and I apologize. All right. So here's some questions I would ask. Did the student fail to make progress on their post-secondary transition plan and goals? So I would look at the PTP, post-secondary transition plan, look at those goals, and look at whether the student failed to make progress. I would look at, has the student received planned transition services in order to prepare for post-secondary goals in education or training, employment, and when applicable, independent living? And is the student connected to supports and services that will facilitate a smooth transition to post-secondary environments? I love that question, Matthew, because I think that for transition aid students, the analysis is different. I would not be worried about that regression compared to same age peers without IEPs. I would be more looking at the PTP and some of these questions to make that analysis. And we actually developed these questions based on some federal guidance, and in the resources section, there's some references to those federal documents and guidance around making these decisions for students who turn 21. So again, it's all about, what does that student need to be successful to transition after they turn 21? And are there things that they could not get because of the pandemic that they still need to be able to do that? And I would say still need from the school district, because again, in some situations, the other state agencies would be doing that already, because you get to that age and there's a lot of kind of cross-pollination of resources and supports across various state agencies. So that's how I would make that decision.
Okay, so if you have time for one more, that's what
Yeah.
we've got, and this person chose to still be with us. So back to the thought train of ESY related things. It's a two-part question. It says, do you suggest delineating separately in the IEP what services are needed for ESY and what services are needed for compensatory? And if so, should the ESY discussion focus on past regression or anticipated regression?
Boy, that is a great question. So one answer to that question is it needs to be clearly documented in the IEP what the student is going to receive. There needs to be clear documentation of both the additional services and potentially, if applicable, the compensatory services, and be clearly labeled as such. ESY is a time when those services could be provided, right? So there's a connection to that. And the ESY services might include ESY services the student would have received anyway, right? Because we know some students have extended school year when there's no pandemic, and may also include the compensatory services. And so it should just be very clear, what are the services the student would have received in ESY because of compensatory services, what are they going to receive that is in addition? So it just has to be very clear to the parent to anyone looking at the IEP what those services are, how they were determined, the frequency, duration, location, and amount of them in terms of documentation. I don't know if we have a specific format for that. That could be a good question, again, to loop back to DPI to ask if they have a preference on that documentation, because there's a frequently asked questions document on the DPI website. And I'm just going to go there really quick. I'm going to do Wisconsin DPI COVID SPED in a search box. And then one of the first documents you'll see is this question and answer document. And we were updating this weekly at one point. I think it's trickled down to every few weeks or a month, but we still get questions. We're like, that's a great question. We're going to add that. You know, we recently put some information about students graduating and turning 21 here, and compensatory services were added fairly recently. So this document may have the answer, but contact us, and if I didn't answer your question, and you hopefully get a clearer response, and also you might even go in here so others can benefit from it.
All right, so that is all we have in terms of questions. I will stop the recording.